Hi there, my name is Dr. Cary Yurkiw. Today I'm going over the best beginner stretches for low back pain, hip pain, and sciatica. So often I give my patients yoga type of stretches, and I'll just caution you to make sure you talk to your health professional before you start anything new like this. So today, Healthline had this good article on 10 yoga poses for sciatic pain relief. And really, you can use this for low back pain, sciatica, and hip pain as well. The first pose is the child's pose. Very easy to do on your knees, just sitting back, extending your arms overhead. If you have any knee pain or ankle pain, you may want to modify this position with some extra padding. But this is very good to do, just gently rocking back, holding for 2 to 3 seconds, going back up to this position on all fours, and then back down into this seated position on your ankles. I would do 8 to 10 repetitions of this. It's a very good exercise to get the fluid moving, a stretch in the low back, and a little bit of traction there as well. Downward facing dog, excellent. This is a position where you start on all fours and then you extend your hips up to the ceiling, and then your upper body points down towards the floor. And you want to just gradually go between these two positions. I would go slowly, and it really does help stretch out the area between the low back and the hips. The half moon pose, I wouldn't do this one initially. I would wait to do this one after you get the beginner exercises going and they feel good. This is more complicated. I would call it a level 2 intermediate exercise, putting your hand down, balancing, and then twisting to open up the lumbar area. Cobra, excellent to do lying flat on your stomach, just arching your back, pushing up with your hands, creating some extension in the low back. I would do 8 to 10 repetitions of this and just pause for 1 to 2 seconds right at the top of the range, and then back down to the floor. 8 to 10 repetitions, that's one set. See how that goes, and then talk to your doctor or healthcare provider about this, and then go to the next step, which would be 2 sets of this, and then later some intermediate or level 2 exercises. I wouldn't do this one, the locust pose. It's a little harder. It actually starts to build strength in the low back. I would keep this until level 2 or level 3 of your exercise program. Number 6 is the knee to chest. This one's very good, bringing your knees up to your chest, using your hands to help. I would keep your head on the floor here and your upper back, and just bring the knees in and hold them for 1 to 2 seconds, and then relax them out, and then bring them in again. Later on in level 2 or 3 of an exercise program, you can lift your head off the ground and your upper back. That starts to contract the abdominal muscles, which is important for core strength, but it's going to work those muscles, and it's more of a strengthening activity. I like this more for the stretching in level 1. The reclined pigeon pose, a little more complicated because there's some flexion and there is some twisting here. I would wait to do this in a level 2 of a stretching routine. This one right here, the bridge, excellent. You can do this in level 1, just lifting the hips off the ground, holding for 1 to 2 seconds in a neutral position, and then back down to the floor again. 8 to 10 repetitions. And then this one, twisting. I wouldn't do this until level 2 or level 3. The rotation's good to exercise the discs, but it is a little bit more of a complex movement, and it can really stress some of those lower joints. So I would wait till level 2 or level 3 of an exercise program. Similarly, I would wait till level 2 or 3 to do this. This is where the legs are up, you're extending the knees, it's tractioning the sciatic nerve, something we call nerve flossing. I would wait to do this until level 2 or level 3. If you have any questions, feel free to ask me in the clinic. If you don't see me, ask your healthcare provider before starting something new, and I will talk to you guys soon.